Hello, thank you so much for coming back to join me. Hi, I just want to talk about 8 very quick tips to give to you if you are a new nurse, a new traveler. My seasoned nurses, you probably know all this stuff, but good refreshers. And if you can add anything below, please do, of course. All right, so 8 tips. I want to talk about 8 tips that I would like to give, or pearls to share for your acutely sick cardiac patients, those patients who are having acute coronary syndrome, those patients who are about to code or coding, those who are having some kind of arrhythmia that you need to quickly intervene with. Just a few quick tips, 8 of them. All right. First and foremost, ER nurses, bring your stethoscope to work. All right? That's all I'm going to say, because you know what I mean, especially if you've been doing this for a long time, because I too went through a period of time, when you feel kind of comfortable with what you're doing, and I'm going to say maybe it was like year 5 to maybe year 8 or 9. Yeah, long period of time where I was one of those nurses, and there's plenty of them out there. I would say maybe 50% of them in the ER who do not bring a stethoscope to work, right? If you needed one, you borrowed one, or you use one of the cheap ones that are in the supply room that everyone sounds like they have a friction rub because they're so damn cheap, right? So please bring your stethoscope to work. Be one of those nurses that actually listens to your patient. It takes 30 seconds. I listen to their back. I listen to their heart. I listen to the belly. I mean, it takes 30 seconds. Remember, right? They're there for the show, and you're there for the chart, right? And how are you going to assess your patient, and they come in for shortness of breath, and your respiratory therapist is giving them neb after neb, and now they have to go on BiPAP, and now they're not doing good, and they're deteriorating, and you might have to tube them. If you are ever pulled up in a court of law, the first thing they're going to ask is probably, how did you assess your patient? How are you charting breath sounds, right? So be very careful, and please bring your stethoscope to work and use it. You are not above your stethoscope. It's so important. It's there for a reason. All right. I think once you kind of cross over from competent to proficient, maybe something clicks and you realize like, oh shoot, I need my stethoscope with me. And that's for all specialties, but especially in the ER, because we need to be using that several times a night. All right. A day or a night, whatever shift you work. All right, so that's number 1. Use your stethoscope. Number 2, know your algorithms. Know your Brady algorithms, your TACI algorithms, your AFib. What does your facility do when someone comes in with AFib, rapid response? What are your algorithms? Because it's going to be very helpful for you to know exactly what you're doing and what step and what meds to give, because remember, those meds are also in your ACLS algorithm, right? If you have a patient that comes in, VTAC with a pulse, right? You want to know, okay, my doc's probably going to want to give amio. My doc's going to, you have to kind of know, be a step ahead of the game and kind of be thinking what your provider is going to want to order. So know your algorithms. It really does. It helps, and it takes a while to get all of them down and separate all of them. But once you know what to expect, I think it really helps you see the big picture of your code or of your deteriorating patient. Right. Next, I think every emergency physician, PA, AP, RN, and future RN should be watching this physician, AMAL MATTU. All right, AMAL MATTU. He's a professor of University of Maryland, I believe cardiology professor. He is an EKG guru. He is the best speaker, hands down, I have ever heard, you will ever hear when it comes to the topic of electrocardiology. That is his specialty. You will listen to him. Now, listen to him when you're in the car driving to work. I know a lot of people listen to do TikTok in the earbud at work. Listen to AMAL, all right? He's entertaining, and he will teach you so much. You will understand your rhythms so much more just by listening to him. He's absolutely brilliant. I will actually link below my favorite video, or it was a lecture from him on tachydysrhythmias and bradydysrhythmias. This lecture is, I think, 114 or 141 minutes. I'm not sure, but let me tell you, it is gold. The pearls are gold. And now it is high level. It's high yield information, because this is like board prep. This is board prep stuff for ER certification. Listen to it, nurses. It is a little bit above our heads, but we can get there. It doesn't have to be, right? So I think the first few times I listened to these lectures, and I listened to them several hundred times probably by now, it took a while for me to understand certain verbiage. I'd have to look certain things up. I'd have to get it. But let me tell you, once his lectures click, they click. I was never the nurse to sit and feel comfortable talking to you about Mobitz 1 versus Mobitz 2s versus, junctionals versus idioventricular rhythms versus, I still get a little fumbled on my left and right bundle branches. I really have to look at them. But, I was never the one to be talking about Brugada and looking for Wellens waves. And I'm telling you, AMAL MATTU. That's all I'm going to say. You will thank me later. All right? Know your causes. Know your causes of things. Know why your patients, the QT interval is long. Why torsades happen. Is the mag low? Am I giving Zithromax? Am I giving Zofran? Know your H's and T's, right? Start thinking about the causes of things, and that also helps you put everything together in the big picture, right? And also in that, don't forget about tox and metabolic causes. Another Mattu pearl. Don't forget about tox and metabolic causes during codes. We're so focused on cardiac and respiratory. I think sometimes we can forget that in those H's and T's, we do have to consider our tox and metabolic causes. Very important, right? This one's easy. It should be easy. I'm sorry I'm even saying it, but you know what? Put your patient on the monitor. Just put them on the monitor. Now, if they're there for toe pain, if they have a back pain for a week because they bent over and picked something up, no, I'm not putting them on the monitor. But if there's a belly pain, if it's a shortness of breath, if it's anything I don't really like, guess what? I'm gonna put them on the cardiac monitor. Well, it doesn't take but a few seconds, and it just shows you're being complete. Make sure you chart it. You never know what you might find when you put somebody on that monitor, so don't be afraid. And also, if things go south, you want to make sure that you can back up your charting and have proof that that patient was actually being monitored correctly, right? So, belly pain, shortness of breath, dizziness, I'm putting you on the monitor. It just is so much easier and safer for everyone. And you know what? My next tip, if the heart rate is under 40, I don't know, your facility may have a different protocol. My personal nursing judgment, if your heart rate is under 40, I'm putting you on pads. You are getting pads. I don't care if anyone looks at me funny. If that's their history and that's their regular rate, that's one thing. But if I see a heart rate that is under 40, and especially if it's irregular, they are absolutely going on pads, on defibrillator pads. Now, also, next tip, that being said, play with your defibrillator. sit with it. Sit with it when there's no one attached to it and there's no stress and it does not matter and no one's watching you, or you and your friends are just playing with it during some downtime. Sit with it. Do a little defibrillation. Cardiovert someone. Set it up to pace. Play with the milliamps, because you know when you're using this equipment, it's go time. Your patient is circling the drain. Things are not going well. You're all just moving. You are boom, 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 boom. Everything has to kind of fall into place. And the last thing you want to be doing is fumbling with your defibrillator. The last thing you want your patient's family or your patient to see is you trying to fumble to figure out how to pace and how to capture it. It's always a work in progress. So please make sure that you are up on it and doing your homework and playing with that defibrillator, because you don't want that. You don't want to seconds count, right? At that point, seconds definitely count. And that being said, another tip, I just thought of another one. The last one, I think this is the last one. Looking at my list here. Can you tell? Oh, there's two more. Respect your defibrillator. What do I mean by that? It should not be on top of your code card with wires entangled and all messed up and everything everywhere, and nothing makes any sense. I don't know who is designing these defibrillators, but maybe us nurses need to get together and figure one out and go on Shark Tank and make it happen, because there's no good space for these wires when they really could be retractable. And some of these defibrillators, I've traveled to facilities and they're a mess. I'm like, this is an emergency piece of equipment. I worked with the wonderful traveler, Michael Swift, God rest his soul. I'll never forget one day he came up upon a defibrillator that was a hot mess and he lost his mind. I was going to swear, but you know what I was going to say. He lost it. Taught me a valuable lesson. The tech that had left it that way, he gave a good scolding. This is an emergency piece of equipment. We are using this when seconds count. If I have to take 40 seconds to untangle these wires so that I can properly put this patient on the monitor, that's not acceptable. So respect your defibrillator and make sure it's neatly put away. Make sure your cords are wrapped nicely and make sure it's plugged in. And make sure that there are pads with an extra set of pads nearby. And as corny as it is, know where your razors are, because you're going to get that hairy bear that comes in and the pads won't stick. So just simple things to have lined up. If you are assigned, your trauma rooms or your code rooms, make sure that all that is done. Of course, and suction is set up too, little side pearl. But yeah, make sure you have all that in place, and that your ambu bag is in the room too, because that can happen. And you look in the bag of the patient and there's no ambu bag, so that sucks. Last but not least, my last tip: slow push your meds. Now, again, check your facility's policy. I don't work there, right? They have a prescribed amount of time they want you to push the meds, and I'm sure. However, me personally, I do find take the higher limit of that. If it's 3 to 5 minutes, take the full 5, right? I do find if I'm pushing like a diltiazem or cardizem for an AFib, rapid ventricular response, I personally see a better response and get a better result of that patient converting if I push that med very slow. I don't know why. I really don't know what the pharmacokinetics is behind it. I guess I should look it up before I came on here and spoke on it, but I do find like pushing my cardizem, pushing my amio, those go. Now listen, if they're coding, we know they're not going to get any deader. And I hate to use that phrase, but that's the phrase we use in emergency medicine, right? You're slamming that in, you're slamming that epi, you're slamming that amio. Hopefully you're not ever IV pushing epi on anyone that's not in a dead situation. But, you're really pushing those meds if it's a code. However, if my patient is, VTAC with a pulse, I'm going to push that amio nice and slow and steady wins the race. My patient is, AFib, RVR, pressure's 88/54. I'm like, oh my God, here we go. I'm going to push that cardism nice and slow. And for some reason, I feel like I personally get a better convert rate the slower I push those meds. I'm not sure, again, what it is. If you know, tell me below. All right? So yeah, those are my little cardiac pearls, my little things for you. If your patient is a cardiac patient or circling the cardiac drain, things that you can do to help yourself and your patient. And I am serious when I tell you that AMAL MATTU will literally help you go from novice to proficient with your EKG knowledge, and you will enjoy every minute of it because he's that damn listenable. He's just so listenable. He's funny, he's quirky, he's so smart, and he's giving you such high yield info, but at a level that you can really absorb it. So if you are a nursing student struggling with your rhythms, or if you're a PA student, APRN student, if you're a doc studying for your boards and you're kind of flustered, let me tell you, this is he's the pearl. He really is. So, all right, have a wonderful day. Keep saving lives, keep doing what you do, and I appreciate you listening and watching. Have a wonderful day.